Good morning and good afternoon to everyone. Thank you so much for joining us. We are thrilled to have you. My name is Mary Kay Clunies-Ross, and I'm the Executive Director of the Chronic Disease Coalition. The coalition has just celebrated its 10th anniversary of advocating for patients and helping patients advocate for themselves. We are really excited to be doing this event because our perspectives and the perspectives of the people on this call are incredibly important to the policymaking work that we have in front of us. I know that everybody's got a lot of time pressures, and the fact that you made time today to be with us to learn is wonderful. I also want to recognize that we do have some elected officials on the call, as well as some congressional and legislative staff members who are representing those. We'll be celebrating our elected officials next week when we release our list of champions for both the state legislatures and the congressional level, and just very much appreciate that not only do you show up during legislative session, but you show up in off times to learn and to listen to the chronic disease community. I want to be very, very purposeful about what we're doing here today. The experience of chronic disease patients in our healthcare system has always been important. That's why the CDC got started 10 years ago, because we are heavy users of the system. But we know that even now, more than 10 years ago when we got started, that the rates of chronic disease have increased. And in fact, 75% of Americans manage at least one chronic disease. And half of us are managing multiple chronic diseases. So no longer is our experience emblematic, it's actually systematic. We also know that as a nation, we're spending more on healthcare than we used to. But at the patient level, we're not always feeling the benefit of that. And so we want to explore a little bit of why that is. To me, one of the most shocking pieces of data that came out of our survey was the degree to which even wealthy families are feeling a financial pinch due to their healthcare spending. The pain and the corresponding lack of access to care is that much more for our low-income families, and even our mid-income families and working families. So we really need to think about how we can do this better. Also, universally, patients carry a huge logistical and emotional burden between managing doctors and referrals and pursuing our care, being CEOs of our own health, but also having to work to figure out how it's all going to get paid for, both between the insurance companies and us. So the experiences that we're having are pretty universal. I think that's one of the other big takeaways of our survey is that our experiences in the healthcare system are nonpartisan. They're not tied to geography. They're a little bit tied to demographics, but we have way more in common than we do separate. And so we're excited to explore that today. This conversation, I think, will provoke more questions than we can answer, certainly more questions than we can answer in 1 hour, but also more than we can probably answer by ourselves. That's okay. To me, if this conversation piques your curiosity, gets you thinking and wondering about what's going on and how things could get better, that's great. That's the conversation that the Chronic Disease Coalition is here to have on a consistent basis. We can tackle these things one by one when we have an open and curious mind to both the problem and the solution. So if you end up with more questions, then we actually feel like we've done our job. Listen, but we do have space for questions, so please feel free to use the comment section to put your questions in. We will answer what we can in the time allotted and get back to you in a consistent way after that. And I don't want to waste any time here. We've got a great panel of our patient ambassadors here to speak to us, but we're going to start with our research partner. Andrew Thibault of Fulcrum Strategy Group has been the Chronic Disease Coalition's research partner for a long time. Andrew was with us when we first did this study 2 years ago, and he has great insight to share about what we're seeing now. So Andrew, take it away.
Thank you very much, Mary Kay. And from Seattle, good morning, everyone. I'm going to walk you through the research here. As soon as the screen pops up, I'll get into it. We're good to go here. Okay, so this is a nationwide survey that was just recently completed in June. It's a survey of adults age 18 plus living with one or more chronic diseases. We have 1,000 completed interviews, so it's a pretty robust sample. And as I said, it was conducted in the first few weeks of June. Starting at the end here, putting some context around all the numbers, 1 in 5 respondents who we talked to were not initially aware, or they were unsure if they had a chronic disease. But once we provided them with a definition, they said, oh yeah, that's me. So that's 1 in 5 people living with a chronic disease who were not initially aware that they had a chronic disease. Some of these things Mary Kay said, I'm going to show you the actual data here coming up, but half have more than one chronic disease, and 1 in 5, so 20% of folks have 3 or more chronic diseases. Half have been living with chronic disease for 10 or more years. So it's a long-term challenge for folks. 2/3 waited more than a year to get a formal diagnosis of their disease. And then the impact is beyond just the individual, as Mary Kay talked about a little bit, but it's not just the chronic disease patient in the household. There's 1 in 3 adults are living in a household with at least one more adult who has a chronic disease. And in households with children, 1 out of 4 of those households have a child with a chronic disease. Age is one of the strongest drivers of attitudes. We found that throughout the survey, younger patients report much more difficulty than those age 65 plus on nearly every measure of the challenges they face living with a chronic disease. Not surprisingly, the uninsured, which was 6% of our overall sample, face far higher cost and access challenges than those with insurance. And it doesn't matter what type of insurance folks have, even if they're self-insured, the uninsured have higher cost and access challenges. And lower income households experience more significant work and cost impact. And the work impact is particularly important to note because in lower income households, that income is so important. 2/3 of chronic disease patients say a candidate's position on healthcare and chronic disease is either the primary issue for them when voting or it's a top issue. So folks are taking this into account when they decide who to support. People of color, urban residents, and younger residents are the most likely to say that healthcare is a key voting issue for them. And then, as Mary Kay pointed out, partisanship is not a major factor here. Folks' attitudes and experience living with chronic disease does not care if you're a Democrat, Independent, or Republican. It affects everyone. Getting into the data, so this is that initial question I talked about. Are you currently living with 1 or more chronic diseases that impact your day-to-day life? So we asked folks that. 8 and 10 said, yeah, that's me. 15% said, no, I'm not. 5% said, I'm not sure. We then followed up with that 20% and provided them with a definition of a chronic disease. So a condition that lasts for a year or more and requires ongoing medical attention and impacts your life. And then those folks said, oh yeah, that is me. This is a question about adults in the household with chronic disease and kids. So of the people we talked to, almost 1/3 had 2 or more adults with chronic disease in their household. And of the households with children, 24% had at least one child with chronic disease. The chronic diseases that people are dealing with, arthritis and diabetes, are the top 2, but you see a whole host of issues that folks are dealing with. And as Mary Kay said, 48% of folks are living with 2 or more chronic diseases. 1 in 5 are living with 3 or more chronic diseases. The time to get diagnosed, 1/3 were diagnosed in under a year, but the rest, the other 2/3, it took a year or more to get diagnosed, and 3 out of 10 waited 4 or more years to get a formal diagnosis. How long have folks been living with their chronic disease? You can see 74% have been living with their chronic disease for 5 or more years. A half have been living with the chronic disease for 10 or more years. What are the challenges? So we asked folks, how difficult is each of the following for you? Managing the stress of dealing with your chronic disease or managing your mental health is the most difficult aspect of the things we tested. So 60% said they found that difficult. Predicting the cost of your care including medication and treatment. 46% said that was difficult for them. And I want to point out here, normally in polling, we say things like a majority say this, a super majority say this, and we really focus on where the predominant opinion is. But when you're talking about barriers and difficulties, even though 46% is not a majority, that's a substantial chunk of the population who is having challenges with predicting the cost of care. 4 in 10 people are having difficulty getting access to the right specialist. Almost 4 in 10 had difficulty getting a formal diagnosis. And 3 in 10 have had trouble getting their insurance company to approve prescribed medication. I'm going to show you a little bit of subgroup data. I'm not going to spend too much time on it because we have other slides that break this out. But if you look at the responses from various age groups that are particularly impacted, so managing stress, folks under 50, 73% say that's difficult for them. The uninsured, 76% say it's difficult. Predicting cost of care, younger folks are having more challenges there. The uninsured, 87%, it makes sense. They're having challenges predicting the cost of their care. So it's a massive impact for the uninsured. Getting access to the right specialist. Again, you see this pattern that younger folks and the uninsured are facing higher hurdles on getting a formal diagnosis as well. And then getting your insurance company to approve medication. Young folks at a higher rate are having difficulty there. Some other challenges. So we asked folks if they agreed or disagreed with these statements about access and chronic disease. I feel the mental health impacts of managing a chronic disease are not talked about enough. 3/4 agree that it would be good if we talked about this more because it makes it easier for them to talk about it and manage it. We need to recognize the impact of stress and mental health on overall health. My condition impacts my ability to work or has impacted my ability to work in the past. 6 in 10 are experienced or have experienced work impacts. Folks feel more vulnerable to contagious diseases. So that's another thing that chronic disease patients are having to think about in their lives. If I had more support for my mental health, such as counseling or a practical support group, my physical health and chronic disease management would be better. Half agree that that's true, that it's not just talking about mental health impacts, it's doing something about it. Because of the cost of treatment, I sometimes have to make choices between treatment, medication, and other basic necessities. 36% are making choices in their day-to-day lives about, are they going to take care of their health or other necessities? I feel I receive a different standard of care because of my age, gender, and or race. 35% feel that they're receiving a different standard of care. Affected by closures or reduced services over the last 2 years, 1 in 4 are being impacted. And I feel discriminated at work because of my medical needs, or I have felt discriminated against in the past. 1 in 4 are experiencing some form of discrimination at work. With the subgroups, you're going to see a lot of similar patterns here because the 3 most impacted groups are, the 3 groups with the highest level of challenge have been younger folks, the uninsured, and low-income folks. You see that here as well. My condition impacts my ability to work. Rural voter or patients who live in rural areas, this popped up. Income folks. Vulnerable to contagious diseases. Folks who live in suburban areas are more likely to say that they feel vulnerable, which makes sense, more dense. And then also African-American chronic disease patients. More support for mental health. Young folks really want support for mental health, as do the uninsured. 62% of those under 50 say it would help. Choosing between treatment and other necessities. Young folks and the uninsured is a particular challenge for them. Different standard of care. Young folks feel doubted in the system, or we'll see in a second, are more likely to have been told that it was all in their head, are just less likely to be believed in our healthcare system. And then African Americans also saying that they feel they receive a different standard of care, 45%. affected by closures, young folks and the uninsured at higher levels, and then being discriminated at work. Those under 50, more than a third are saying they've felt discriminated against at work. Jumping into this, we've seen a lot about younger patients and their experience. So let's look at some of these numbers by age group. So my chronic disease impacts my ability to work. You can see much higher levels in the younger age categories, tapering off, and 65 plus, it's 44%. Sometimes I must choose between my care and other necessity, a majority of the youngest age cohort. But you see that that being forced to choose has a very strong age component. Told it's all in your head. 41% of those under 35 say, yes, I have been told it's all in my head, compared to only 3% of those 65 plus. I feel I receive a different standard of care, half of the youngest age cohort, and 42% of that next group saying, yes, because I'm young, I receive a different standard of care. More difficult to access specialists in the younger cohorts. I've been affected by closures at facilities, healthcare facilities, more impactful for those under 30, under 50. And then finally, mental health support would help. I think some of this may be that, for younger folks, there's less stigma around mental health care. And so they're more willing to embrace mental health support. You can see more than 6 in 10 of those under 50 say better mental health support would improve my condition. Looking at the uninsured, so across 4 metrics here, and I'm showing the numbers for the insured folks. Difficult to predict cost of care, sometimes must choose between care and other necessities, access to specialists, and getting a formal diagnosis. The uninsured have much more significant challenges across all of these dimensions. It makes sense, but it's part of the conversation that they're not just dealing with their care, they're dealing with all these other challenges as well, which create even more stress and difficulty managing disease. And then finally, lower income households impacts my ability to work. Of those under where the household income is under 50K, 7 in 10 or more say their ability to work is impacted by their chronic disease. 66% of those earning up to 75K. But even among those, as Mary Kay said at the outset, where the household earns 200K or more, nearly half are saying that their ability to work is impacted. So the impact is, even though there's some differences by age, there's a universal impact on folks' ability to work. And the choice between care and other necessities, more impactful at the lower income ranges, but still all the way up to 150 to 200K, 35% say they have to choose between care and other necessities. And I think if you told a lot of people that a household earning $200,000 a year or more was having to make these same kind of choices, it would be surprising. This is an open-end question. So what that means is we ask folks, what about dealing with your condition gives you the most stress? And they type in their answers. And then we aggregate those answers into categories so that we can report percentages. So you lose a little bit of granularity here, but it tells you kind of the themes, the top themes in terms of stressors. And just being sick, dealing with symptoms, not feeling well, a third say that gives them the most stress. But then second is just the uncertainty. I don't know what my long-term prognosis is, even fears about death and mortality. 1 in 4 thinking about that. And so you can easily see how these things contribute to stress and other challenges. Functional limitations and loss of independence. 1 in 5 say that's their top stressor. 16% financial burdens, the emotional, psychological impact, managing the condition. You can see lots of different stressors. It is not just about the disease and your health, but all the domino effects. We asked a series of questions about different groups. So here, your doctor, your nurses, your local clinic or hospital system, and an insurance company. Are they aware of your condition? Are you comfortable talking to them about your condition? Do you feel supported by them? And then this last column here shows the gap between this group is aware of my condition and I feel supported by them. So these healthcare touch points, near universal awareness. And doctors, nurses, and clinics folks generally feel comfortable talking to them. They feel much less comfortable talking to their insurance company about their condition. And then in terms of support, 70s and 80s in terms of doctors, nurses, and clinics, but only 61% say they feel supported by their insurance company. That's a 30-point gap between my insurance company is aware and I feel like they support. There is a gap with the others, but it's much smaller. Looking in folks' kind of personal and work life, we asked the similar questions about awareness, comfortable talking to, and feel supported by. We also asked the people kind of in their more personal circle, do they worry about the impact on those folks? So you see, most folks, their partner is aware, 94%, but 6% their partner or spouse is not aware. 77%, and this is of folks who have kids, say their kids are aware. 88% their friends. Only 58% have told their employer, and they're not very comfortable talking to their employer about their condition. They don't, there's lower support numbers, but of course, only 58% have told their employer about their condition. So, this 40% is discounted by that fact. In terms of looking at the impact and worrying about the impact, not surprisingly, folks worry most about the impact on their direct family, their partner, or their kids, less so about their friends. I'm surprised that a third here is also discounted by the fact that only 58% of folks have told their employer. So 34% worry about the impact. The gaps here, they're double digits. The friends is a little higher here, but 88% are aware. They only feel supported 69%. And then also with an employer, there's an 18-point gap between aware and feel supported by. But again, 42% haven't even told their employer, and that tells you a lot about how comfortable they feel and how supported they might feel. How much do you rely on each of the following to help you manage your chronic disease? So we offered these specific examples here and said, do you rely on your healthcare provider a great deal or some? Overwhelmingly, folks rely most on their healthcare provider. There's a huge gap, both in terms of intensity, that is, I rely on this great deal, and all the other things we asked about, health system website, internet. Yes, majorities rely on that, but it's not a great deal. It's just more some. Disease organizations, a third, and then dropping on down. Social media, really here at the bottom, and not many folks relying a great deal on social media, which is probably a good thing. Employment, which of the following best describes your work situation? I am able to work as much as I want. I'm retired and not looking to work. I would like to work more, but my health makes it too hard. I am fully disabled and completely unable to work. I would like to work more, but I can't find an employer who can accommodate my condition. So 21% are saying they would like to work more, but there is something that is preventing them. And we asked people, are there specific services or support that would help you, saying would enable them to work as much as they like, as workplace accommodations and support. So it's not just physical accommodations, but it's a welcoming and supportive environment. A third mentioned that. Flexibility in schedule and time off, because chronic diseases and flare-ups can be very unpredictable. And then remote work options, because logistically, it's easier to manage your care when you're at home and you don't have to deal with transportation and things like that. So I think suggestions that make a lot of sense. An aspirational question here. There's another open end. We don't provide responses. We just categorize them. How would your life be different if you had access to the best possible care for your condition? And this top set here is really just about having better care, feeling better, improved condition, health is properly managed. 42% are mentioning something in that general theme. And then 12% are mentioning something directly about less stress, being more comfortable. And then another 1 in 5 are talking about, this would give in the best possible, if I had the best possible care, my life would just be more normal. I could live a happier life. Impact on voting. So we asked folks, how important is a candidate's position on healthcare and chronic disease issues to you when voting? 1 in 5 said it's the primary issue for them. Another 50% or so said it's a top issue, but not the number one issue. And then a third said it's one of many issues. If we look at the difference between or where the kind of the subgroups where folks are more likely to make healthcare the primary issue in their vote, people of color, 28% versus only 18% of self-identified white voters. Urban folks who live in urban areas, 27% say it's a primary issue. It's a little bit higher amongst Dems than Republicans, but in today's in hyper-partisan environment, this gap is very narrow. And then younger folks, under 50, more likely to say it's a primary issue than folks who are age 50 plus. And then one last open end. If you could speak directly to elected officials and policymakers, what would you tell them about living with a chronic disease in our current healthcare system? And the number one issue, it doubles up the next highest issue, is about making healthcare more affordable. Really, those top two, reduce or cap prescription costs and make healthcare more affordable. That's 4 in 10 out of the folks who responded. There's other measures about quality and things like that, but even strengthen and expand insurance coverage is about cost as well. Direct government support for chronic disease patients certainly has a cost element. So if you combine all of those, it's close to 6 in 10 mentioning something that touches on the cost of care. And that is it.
Thank you, Andrew. That was super awesome. I really appreciate that, and that gave us a lot to talk about. So, with that in mind, you don't want to just hear from me. We want to hear from our patient experts who are walking this walk every day. I'd like to have them introduce themselves. Maybe if we can get everybody on the view so everybody can see everyone. These are all people who are patient ambassadors from the Chronic Disease Coalition. They volunteer their time and their expertise in a broad variety of ways. And so I'm going to ask them all to share their name, a condition that they manage, or all the conditions that they manage, and their home states. So let me start with Tori.
Hello, everyone. My name is Tori Lopez. I am from Florida and primarily manage gastroparesis and endometriosis.
Great. Thanks, Tori. Gwen.
Hello, everyone. I'm Gwen Mays. I live on the eastern shore of Maryland, and I was born with a genetic mutation that led to hypertrophic cardiomyopathy, which is a stiff, thick heart muscle. And I have also developed over the years persistent atrial fibrillation.
Thank you. Anna.
Hi, I'm in Indiana, and I'm one of those that have more than 3. I have headache diseases and multiple sclerosis, as well as complex regional pain syndrome.
Thank you. Lathan.
Hello, everyone. My name is Lathan Singleton. I am a sickle cell inheritor out of Long Beach, California.
Thank you. And Adam.
Hello, everyone. My name is Adam Lindo. I manage vestibular migraine and a vestibular disorder, and I am also based in Florida.
Great. Thank you so much. First, I think, we want to talk about access and affordability, and those are very interrelated things. As Andrew made clear, these are high on the list of priorities for us as individuals, but I think, for our entire group. And I want to start with you because we've talked about your home state of Indiana and how some of the closures have impacted you. Could you speak to that a little bit?
Sure. One of the ones that really spoke out to me was in the next county over, they closed all maternal services. And it made me think back to when I was pregnant and managing chronic diseases. To have to add on an extra 30 to 60 minutes to receive care would have been very overwhelming.
Very scary for families. So now that there's been closures at a county over, but that's impacted your ability to access care a little bit, right?
It has. So one of the areas is primary care. So I'm seeing a lot of people leaving primary care, as in primary care physicians leaving. And so one of my kids, adult child, she has gone, two primary care physicians have left in the last 2 years. And so now she's got to find another one, and it's going to be another long wait time just to establish care again.
Mm-hmm. I think we sometimes think we don't always realize how things that impact other people impact us as well. That's a very good example of how that works in the healthcare system. It's also important to think about when we think about system cost. Primary care is a lot less expensive than emergency care, and you'll hear this come up a couple of times too. But as primary care gets harder to access, we're going to see more expensive impacts down the road. So thank you. Lathan, you've got experience with specialty care. Could you speak to that?
Yes, absolutely. When it comes to specialty care, especially when it comes to sickle cell, it's absolutely essential. I would say for chronic disease patients in general, it's essential. You need a team not only of just a primary, just like Andrew articulated beautifully. You need your mind to be taken care of. You need a big and strong team in order to transition into adulthood with a chronic disease.
Mm-hmm. That's very true. And we're glad that Tori will be here to talk to us a little bit in a minute about being young. But Adam, I want to bounce to you because I know you think a lot about this. A strong majority of people said that mental health and emotional health is not talked about when it comes to chronic disease. Could you explain why that access matters so much?
Yeah, I'm happy to. And in addition to the results that we saw today, we can also look at a recent report that was published by the U.S. Centers for Disease Control and Prevention. And they reported that 90% of our nation's healthcare spending is for people living with chronic and mental health conditions. So further validating what we are discussing now. And I can share from my perspective, from the moment that symptoms began to when I got a diagnosis, it was just about 6 months, which we heard earlier that is actually fairly short in comparison to many other individuals. But still, in that short amount of time, it was tremendously physically and emotionally exhausting, as well as financially draining, even as someone who is insured. And then when I was officially diagnosed with that chronic condition, I was faced with the reality that this condition was affecting every facet of my life, my ability to take care of myself, my ability to have a career, my social life, my relationships. And so I had to adapt to this change in identity and living with a different version of myself and my life. And this is something that many individuals are faced with, which is why it is so important to have access to mental and behavioral health support as someone is addressing their chronic disease care. And it's there to help patients cope with their condition, increase their self-efficacy and their quality of life.
Yeah, well put. Gwen, you have a book coming out in November, and for that you talk to hundreds of chronic disease patients. Please add to that.
Absolutely. I think that Adam has really hit the nail on the head, and this really confirms a lot of what I've learned in support groups with patients. So as someone who's had heart symptoms since birth and diagnosed now almost 50 years ago, I know that while it's been a challenge to find the correct care for a rare heart condition over the time, that's almost like an intellectual challenge that has progressed and advanced as access to information has come. But the emotional challenges the day-to-day choices that it made affected every aspect of my life, from not having children because it would be too risky, to remaining single due to a lot of relationship issues. So all of these were echoed with the patients that I interviewed for my book. And even though the diagnosis or the physical diagnosis might be unique, they often shared feelings of anxiety, of disappointment, of not knowing who would believe them. You don't look like a patient. And so it wasn't sometimes even a chronic organic mental illnesses. It was just this sort of persistent feeling that no one understands them. They don't have a place in society. They're uncertain about the future. And this really, really weighs on them heavily. So I heard this a lot interviewing patients for the book.
Those are lonely feelings, and that sense of isolation when three-quarters of us manage chronic disease seems incredibly unfair. Tori, you just graduated from high school, valedictorian. Congratulations on that incredible success, but you're in this exact spot of planning the rest of your life and having to take this into consideration. And you also manage a lot of care for your little sisters as well. Could you talk about the effort that takes?
Yeah, so it is quite difficult. My primary condition that affects me is gastroparesis, which affects how my stomach processes food. So on a bad flare day, I can barely get out of bed because my stomach is in so much pain that it'll reject water, it'll reject food. I can't eat properly. I can't go to the bathroom properly. It's really hard to manage at times. And my chronic illness has pretty much shaped every decision I've made about my future more than anything else has, because it's not just a medical reality, it's a financial one too. Because managing gastroparesis means appointments, specialists, and costs that most families don't budget for. And as a first generation low income student, I've had to think about college through that lens from day one. It's not just which school is the best fit for me, it's what school will actually cover what I need, because I don't have the financial safety net to fall back on if something goes wrong. And there's also the constant undercurrent of having to prove my capabilities to everyone around me, from the doctors who dismiss me to everyone else who looks at everything that I'm managing, from my health to my sisters, my education. And I constantly get doubted that I can actually do it all. So the disbelief has been one of the most difficult and exhausting parts, because you have to constantly fight for people to take you seriously as someone who is capable and not just as someone to feel sorry for.
Yeah, thank you for sharing that. You mentioned sort of the financial realities, and it's clear that people across the board are making financial choices about healthcare. Obviously, more so for the folks who are uninsured or underinsured. Gwen, you've been in healthcare and policy making a long time. What are you seeing along these roads?
That's a very, very good question, Mary Kay. In that, I think, sadly for all of us with chronic illness, money weighs heavily. Where we get our insurance, what we can afford, we make difficult choices at different times in our lives. I know for me, when I was first diagnosed, I was uninsurable. And so I pretty much stuck to a job, kept my head down, because I could not get health insurance. So even though I had a graduate degree in medical care, I was working for the U.S. Department of Health and Human Services, planning part of the National Transplant System, working for the Surgeon General at times. I could not get health insurance. And this was such an eye-opener for me. Now, that was many years ago, and I think there are some positive changes with the Affordable Care Act. We've eliminated some of the discrimination that we felt with pre-existing conditions. There's also been some supplements for Medicaid patients and many other options, but we have a lot of gaps ahead of us. And I think that for each of us on this call, we really have to become, being a patient is a full-time job. You have to really understand your health policy. You have to understand any discrimination. If you get diagnosed, like myself, for people who have a genetic condition, can they get life insurance? You have to understand if you have to have pre-authorization. All of this weighs in heavily every day, and we're making progress. and definitely patients' voices and speaking up is probably one of the most positive things that I've seen integrated into policymaking on a state and federal level. So patients still need to tell their stories.
Anna, you're newly diagnosed with MS, and I can only imagine that those drugs are expensive. But also, there's a real downside to not staying current on that. So, what happens if you're not able to take the full course of what your doctors prescribe?
Sure. So the purpose of the current MS medications is to prevent new damage. So it doesn't reverse course. So if you're not taking the medications as indicated, you stand the risk of more damage, which means more symptoms that cannot be reversed. So more symptoms that get added to your plate to continue to manage.
Which makes it harder for you to live your life, to caretake your kids, and on and on and on. Yeah. Adam, I remember your doctor prescribed a medication for migraine, but your insurance company put you through what we call step therapy. You had to fail first on other medication. Could you talk a little bit about how that worked and how that impacted your health?
Yeah, it was incredibly frustrating because, as you mentioned, my neurologist at the time prescribed a medication that they felt was most appropriate for me, and that was rejected by my insurance due to those step therapy requirements. And unfortunately, had I taken that medication that was recommended by or approved by my insurance, it could have exacerbated my symptoms that we were trying to treat due to the side effects. And two, studies had shown it to be a less effective form of treatment for my condition. Now, thankfully, I was eventually able to get approved for that medication, but it took quite a long time before that happened. And so the reality is that every week or delay that occurs for a patient to receive the treatment, care, medication, or testing that is needed, it comes at a cost, and the cost is put on the patients, and it could be a delay in relief. It could be a delay in their ability to get back to work and provide for themselves, care for their families, or something more seriously, provide them the medication needed to prevent their condition from getting worse.
You saying all that reminds me of how much I hear from patients that in some ways the things that they feel best about are the cures that are actually available, that their providers are prescribing medication that is more appropriate for them. We know more about which medications might be appropriate for people with different gender, different age and stages of life, that might be a better balance to help manage multiple conditions. And so the cures that we have access to are in so many ways so much better than what folks were facing 10 years ago, 15, 20 years ago. And so what we're trying to do is get the medications that are going to most help us as individuals, keep us that, and our doctors and prescribers are the ones who know that better than anybody else. Tori, so you're at the beginning of this. When you're planning, how are you thinking about your cost for medication for the next 60 years? I myself will not need my medication for 60 years. I hope to need it for 30. But you're looking at your life as a 60-year problem. So how are you thinking about that? And how does that impact what lawmakers who are making policy right now should think about affordability issues?
Yeah, so when I think about my future, it's really about finding space for myself financially and otherwise that are actually built for people like me. Because a lot of the times we are looked down upon for our chronic illness, and you have to design your own path for a world that's not necessarily accessible to you. Thinking about my medication, I would hope and I I would hope to tell lawmakers and policymakers that every policy decision you make, every vote on healthcare access, every debate about coverage, it really isn't abstract to us. It's whether I can afford my next appointment. I have two younger sisters. They're 11 and 13, and I'm the primary caregiver in my household because we're in a single parent home and my dad works most of the time. So I have to think about their meals, I have to think about their homework, and managing their medical appointments too. So having those decisions impact me also impacts whether my sisters have a healthy sister to lean on. So I would implore them to remember that chronic illness doesn't really check party lines or income brackets, and this could be your child, your grandchild, someone in your own family, someday needing the exact system that you're deciding on right now.
That's so wise. And I think, you know, sometimes employers are very nervous about chronic disease patients. And what you said very much speaks to why so many people don't tell their employers about their illnesses. But I think that your success in school and your hard work and your ability to find ways around your illness in order to both deliver academically and manage illness speaks to the fact that with a little bit of accommodation, you can really have access to wonderful employees who will work hard as you have through high school. So thank you for being part of this. Lathan, listen, I want to close on you because I think sickle cell is such an important lens for us to look at these healthcare system. It's inherited, it's rare, it's also disproportionate in certain communities. When we talk about patient representation at the policymaking table, what would that mean for you?
Valid representation means a lot because while we are considered a rare disease, we do produce the highest rate of we have the highest population of inherited diseases in the country. So it feels like we're very small when in fact there's quite a number of us. And I just like Gwen said, we can no longer just be a presence, we have to be a voice. And what I'm working towards even more so is being a voice and using that voice as both a sword and a shield. I am a third generation sickle cell inheritor. And I got to see at least one of my predecessors deal with what she had to deal with. And because of that, my family taught me very early how to use my voice and advocate for myself. And while it did that, I didn't know how to be a part of a community either. I did not know how to work with anyone. And I was very alert that I was all I had. Besides my sister and my predecessor, I met no other sickle cell inheritor until I was 18. So being a part of what we're doing now is beautiful. The fact that as warriors, as inheritors, we are in the lobbying space now. We are fighting for better bills now and better specialty care, especially when it comes to the home health care, which I feel is the most essential because I feel like every person with sickle cell and every person with a chronic disease needs a home where they can get overall care. A hematologist could be accessed. You don't have to go to an ER in the chaos of emergency room. That all starts where we're at right now, using our voice, empowering our voice, and continuing to show up yearly as we do to keep that, build that presence and continue to reinforce and ignite the voices throughout the sickle cell community and the greater chronic disease community.
When I know this isn't a totally prepared question, but I'm curious, when you connect and help other sickle cell patients connect with each other in the larger groups that you run and organize, what lifts off of people's shoulders once that happens? What's the most immediate gain for folks who are able to connect with others?
I can give you a personal story. A while back, I went through a sickle cell crisis, which is a pain crisis. Oxygen stops moving throughout your body, and it starts to feel like your bones are breaking consistently. And I went through that for a few days in the hospital, and I lost my mind. I had a whole psychotic break. And when I went to the other ward of the emergency room, and I was looking at myself as a monster, and I thought everyone else was looking at me as a monster. They did not. That was not their first time seeing a sickle cell inheritor lose their mind over pain or sleep deprivation, all of the above. And I lost myself for a while, and then I started going into support groups, and I was very broken, but I didn't have to show up saying I was broken. I didn't have a voice. I didn't have to show up saying I didn't have a voice. It was, you're welcome whenever you're ready to speak. We may have not have been through a psychotic break necessarily, but we have rebuilt ourselves over and over again through our lifetimes. And now I'm here with my voice stronger than it was prior to that break.
Thank you. That's a great description that you just gave about that integration between the mental health impacts of, physical diseases, but these aren't separate things. We need to treat them holistically, and appreciate that as an example. I want to close out with a lightning round. As everybody knows, the Chronic Disease Coalition, we're focused on policy, both state policy, federal policy, and that's because when we can change policy, we even the playing field for all patients. It shouldn't be just us as individuals advocating. If we have a level playing field, that means that the folks with our conditions coming up next will have an easier time. So when we think about that, if you had 5 minutes with a member of Congress right now, what's the one thing that you'd want them to understand that the poll results alone can't convey? I'm just going to go with who I can see on the screen. Adam, can you go first?
Sure. Yeah. So I would want them to understand that if we want to address the rising costs of healthcare and increased diagnosed conditions, then we need to rethink how care is delivered. And that means investing in support roles within our healthcare system with easily accessible pathways for prevention and for education. In addition, I also think chronic conditions should have a comprehensive approach taken that includes medical treatment as well as support for some of the issues that were discussed even today, like stress management and lifestyle modifications and so forth. And if I could refer it back to that report that was released by the U.S. Centers for Disease Control and Prevention, while they did mention that the main drivers for our healthcare costs are chronic conditions, it also stated that evidence-based prevention and management strategies improved quality of life as well as eased economic outcomes. And it's for these reasons I would ask this member of Congress to help accelerate the process of making National Board Certified Health and Wellness coaching a covered service through the Centers for Medicare and Medicaid Services. And this would allow for health and wellness coaches to work alongside a patient's care team to support the implementation of their care plans using evidence-based strategies and allow for a space where patients can feel seen, heard, and understood.
Yeah, that's a great approach to increasing our access to care providers without necessarily needing to produce a lot more MDs. So thank you for that. Gwen, what would you do with your few minutes with a member of Congress?
I think what comes to mind to me is that I would really narrow the discussion down to the most personal level that I could. So regardless of the policy or the bill being discussed or the issue in controversy, I would sort of not only present my own experience that might relate to it, but I would ask them, encourage them to really put themselves in my shoes or put themselves in the shoes of a spouse or a child or a parent. And instead of me trying to impress upon them what has happened to me, somebody they may never see again, what would the impact of this policy or this particular bill or this legislation have on someone who is close to them, their best friend, their parent, etc.? I'd really narrow the gap down to that. And to remind them that chronic disease, the whole definition, or maybe our public's perception that we all did something to develop chronic disease, is just not true. And the data in this survey really proves that out, that there are many young people, there are genetic conditions, inherited conditions, and that chronic disease is not just something that old people deal with, that it has a lifetime of impact on anyone who's been diagnosed.
Thank you. That's great. Tori.
Yeah. I think one thing that the poll numbers can't really capture is that we're human beings first and not just a diagnosis. We're not like a statistic or a line item in a budget. Behind every point, like every data point, is someone like me, a young person who's trying to get an education, take care of my family, and also build a future while fighting a body that also does not cooperate sometimes. And remembering that life doesn't stop no matter how much pain that I'm in. I have to get up every single day regardless of how I feel because my sisters need me. And mentally that comes with a lot of grief for a childhood that I could have had and a life that is not mine anymore. It belongs to my chronic illness. And there's also this constant health anxiety of fear of what could happen in days that I can't function. So I've never gotten to be a normal kid, and I've had to carry a lot of things that many adults don't have to think about. And so my ask isn't just for policy, it's for perspective, I would say, because we have to remember that we are your future leaders, we are your future doctors and your future advocates, and the decisions that you make today determine whether we get the chance to become that or whether we spend our futures just trying to survive the system instead of shaping it.
Thank you. Well put. I'm sorry, Anna, you've got to follow that.
I'll try. First of all, despite how much experience I have in the healthcare system, I still find it very overwhelming. And I can't imagine not having the level of knowledge I have in trying to navigate this system. And so I'd want them to understand how overwhelming the system is, how hard it is to get care and to coordinate and navigate care, and that we need more simplicity. We need things to be easier to access. But also, I want to remind them that patients need dignity, and these barriers that we have create this less than feeling that is really difficult. You know, it's really hard to ask for help, and we need to make that easier. And I think that would end up helping patients overall, because if they could be less overwhelmed, get the care they need and do it with dignity.
Yeah, thank you. Lathan, bring us home.
If I was in that room, I would put on my community health work hat, my transition counselor hat, but I'll also have to bring a child out with me. Because we do fight there is an act for the Health Homes Project, which is a sickle cell disease expansion program act. And that is a place, while the polls are beautiful, it doesn't describe the chaos. And creating a home for patients to not be able to be in that chaos that causes such extensional stress is very, very important. Having a health home is important. because it was a child being healed in a fragmented system that starts. A teenager trying their hardest not to fall off pediatric cliffs and abyss into an adult system is the next toll. A man or a woman lost within a health system that did not know how to hold them is following. And those people were just without structure. A lot of those people fell to the wayside. And I'm 34 now. I watched a lot of them throughout my 20s go to the wayside because they lack structure in healthcare.
Yeah, that's we have a lot to do. And I, first of all, I cannot thank you all enough for being part of this conversation. Your mix of experiences, conditions, geographies, histories has really added a lot of context to our conversation. I'm so grateful to have poll numbers that tell us exactly how uniform some of these experiences are, but your stories are so important. And in fact, we know that these stories are important to lawmakers too. I think, so many people struggle. They don't need to hear my story. They don't need to know my story. I'm just one person in the system trying to make it work. I talk to lawmakers on the regular. They very much want to hear from their constituents and from patients who are experiencing this in ways that they may or may not be experiencing it. It's very powerful to hear these stories and back them with data, as well as with real plans to how we can make the health system better. And so I want to throw up a couple of ways that we can do this. Your story is important. Your voice is important. Even just standing up and being counted is important. Every time you send a letter or sign a petition, lawmakers do track those, and they do pay attention to how many stories they're getting and how many individual voices that they're hearing from. And so we, like at the Chronic Disease Coalition, really part of our emotional message, our mission that brings us to work every day is opening these pathways for folks to be welcomed into their members of Congress office, their legislators' office. They are dying to hear from folks. They don't want to just hear from lobbyists. They want to hear from people. Your stories are important. So here's a couple of things that you can do. We created a petition for Chronic Disease Month. Amy's got that in the chat. You can see the URL. You can go to our website and sign it. Just add your name. More than 100 folks have already done that. It's a very simple step that you can take. And we want it to be the first step that you take if you haven't ever done anything. The second step is send a letter to your lawmakers. We've got letters already pre-written on our website, and they only go to your elected officials. You're not going to spam your entire legislature. You're not going to get lost talking to members of Congress who don't know you. You're only going to be addressing the people who represent you. And I very often hear back from my electeds, and I know that others do as well. So those are primary relationships that we can help build. We've got a voter guide for this year. The Chronic Disease Coalition does not endorse candidates. We are not going to tell you what to do or what to vote for. But what we want is to help you ask questions of the candidates in your district. We want you to know what to listen for in different policy proposals. And our voter guide is just an easy checkbox, one pager designed to help you understand and evaluate the candidates who are running and see how they align with your issues. I think that there's also a few other steps that you can take. We've got a whole advocacy toolkit. If this feels like your jam and you want to do more and more and more, and you don't want to be structured with that, our advocacy toolkit will enable you to dip in and take the steps that you feel most comfortable in taking. I love to have people have meetings with legislators. Most legislatures are out of session right now, and it's a great time to have coffee with your elected official. And by the way, elected official means there's somebody in your neighborhood who got elected by you and your neighbors. You probably go to the same grocery store. You maybe went to the same high school. There's always a lot to talk about, and those face-to-face meetings are incredibly powerful. And then we've got some other things that you can do too that are year round. Like I said, our newsletter is available. We do that 1 or 2 times a month just to keep you informed and to hear some of the stories of the real people who guide our work, our ambassadors, the ones who you saw today. You can share your story, little anecdotes like Adam's anecdote about having to go through step therapy and start with a drug that didn't work as well as the drug that he was prescribed. That kind of journey helps us explain these policy issues to others. And we are always in search of new ambassadors. We very much welcome you in. We've got a great group of people. You can sign up on our ambassador page. The first thing you'll do is meet with me and we can have a one-on-one conversation about what you're trying to do. It's a great first advocacy step because you get to be around other advocates. It's also a great way to augment your existing advocacy work. All the people on the call today have different advocacy work in their conditions and diseases, and they show up for their partners, families, friends, colleagues across the country. And so we can help give you a voice to that work. But we can also help you figure out your first and next steps. And again, just continue to engage with us, listen to us. You can share us on social, even if you don't feel like you've got the time and energy to do too much more than that. That's great. We keep our social positive. We keep it fact-based. We keep it science-based. We hope that you're always proud to share our content. We are always proud to share your stories. We are at time, and I will thank you again for joining us, and have a wonderful day.